Let us call the August 2016 Spokane Regional Health District Board of Health meeting to order. Begin with a roll call today. If we could begin with Torney.
Torney Smith, Spokane Regional Health District.
Keith Baldwin, appointed member.
Brian Begg.
Amber Waldref, City of Spokane.
Bob Lutz, appointed member.
Pam Haley.
Michelle Fossum, Legal Counsel.
Susan Boyson, appointed member.
Kevin Freeman, City of Millwood. We have a quorum.
Although you're a little light on your side.
It's unbalanced.
Oh.
Unbalanced.
We'll watch out.
And for item number 3, citizen input, we have one citizen listed today, Rose Marie Waldron. Rose, if you would approach the podium, thank you. You have 3 minutes, and we look forward to hearing from you.
Well, you wouldn't say that if you knew me, but that's all right. I've been a reasonably regular member or attender here since 1997. And my issue is water fluoridation. For those who may not be familiar with me, I happen to be a former resident of Kingston, New York, which was the unfluoridated control city used in the Newburgh, New York State Health Department evaluation of water fluoridation, which is the only fluoridation test in the United States that was ever completed. The other that was in Grand Rapids, Michigan, which is usually touted as a success, was aborted in 1950, only 5 years into a 10-year epidemiological evaluation, which negated the variable of bioaccumulative toxicity. And because everything was opposed to me as far as being successful this morning, in spite of the fact I've been up since 2:30, I only have notes. So let's let what I've just said be sufficient to pique your curiosity. I'm always available. You can always ask questions, but you know what I've found in the nearly 20 years I've been attending these meetings? Very few people ever ask questions. Thank you.
Thank you. I have no other signatories for citizen input, so let us move on to the chair report. I'd like to start today with a welcome to our new Spokane Valley member, Pam Haley. We also have understanding that Mike Munch has been appointed by City of Spokane Valley, and that will fill our levy again. They will begin, Pam has come early, but they will both be at the regular meetings in September. We would appreciate some of our appointed members reaching out to Pam and Mike to help them and offer their services to get them acquainted with the board, along with the orientation packets that are prepared by Torney. So we look forward to that. Pam, do you have any comments?
No, except that I've already had people reach out to me, which I really appreciate.
Excellent. Next up is a update on the Health Officer Selection Committee, and for that I'd like Keith Baldwin to give an update on the work that was done by himself and our
That's for you, Mayor.
yeah, it's the red phone, obviously, out in Millwood. The work that was done by he and Chuck Hafner over the last couple weeks, and so Keith's going to give a summary on kind of what they've learned from reaching out to some of the other boards and health districts throughout Washington, and let us know on where we are with our looking at potentially making some adjustments, proposing some adjustments, I should say, to our current configuration. Keith?
Well, I'm just going to paraphrase from some notes that Chuck and I put together, a very short summation of what we did. We actually did conference calls with 8 or 9 different districts, both talking to administrators as well as health officers. There were some additional phone calls made before Chuck and I even started, but I just have a couple of notes I just want to sort of go through quickly with you. And again, this was sort of in preparation to complement the additional written information that other people on the health officer search committee have seen related to job descriptions, structures of departments, and all of that. There's a lot of material, and it's just hard to get through it all. And so Chuck and I did some informal interviews to better understand it from other people's perspective around the state. So just quickly, we did talk to Whatcom, Kitsap, Snohomish, Thurston, Clark, the Secretary of Health from Washington State, Seattle, King County, Tacoma, Pierce, and as you may imagine, there are a few, I think 5 counties still, who have a more traditional health officer director sort of position, which is a combined position where a physician both acts as the administrator of the health department as well as administers or manages the department. In a number of cases, like King County, they have now switched to a different structure where they have either split out the health officer and the administrator positions where they were at one time combined, or they have moved to the next step, which is what King County has most recently done, and who we spent quite a bit of time talking to. I think it was Ms. Hayes. Yes, you know her better than I do, I think, Torney. Anyway, because we were interested in this trend toward moving to this particular model, which is to have a, quote, administrator, and some people alternately use the term director, which is not really in the legal language anywhere, but which has sort of come out of Tacoma, Pierce County, and then a couple of other counties, as well as our own. But where the administrator now is the individual who reports directly to the board and who is hired and fired by the board, and the health officer is actually then a position that is mostly related to medical issues like communicable disease, immunization, outbreaks, that sort of thing, but who actually reports to the administrator director. So I think in a nutshell, that really is what our conversations have been about. Why did you have the structure you have? How did you get there? Why is it different than it was in the past? And I think as the health officer search committee gets together the next time around, Chuck and I, which is what Kevin alluded to a little bit, have sort of moved our thinking toward the possibility of talking with the health officer search committee about some possible changes in the structure that we have right now in Spokane around the health officer and administrator position. But that's not for today. Just want you to know that I think we've learned enough information now to really have a good discussion about that before we move on to the formal search process with the search committee. So if there are any questions, Kevin, do you want me to take them now, or?
Yeah, if there are.
I mean, clearly we're not going to get into a lot of detail because there's just too much information right now, but that's a good synopsis, I think, if anybody has any questions about what we've done up to this point.
Do you have a breakdown of which county has which model, and I like the way that you said who's reporting to the board. I mean, I think that's the critical thing. But do you have a list of which counties have which?
Actually, we do have confidential information for all of the Health Search Committee members. We had Ann actually record all of our conversations, and in those you'll see which counties, what people are in what positions, and why, and how they got there. So is that available only to the
yeah,
search
for right now, I
committee at
think,
this point?
Brian, what we'll be doing is that the selection committee will be coming back for a recommendation to the general board, and that we'll put together a complete packet that will accompany the reasoning, and if we have what our recommendations are and all that information, and we can get that out to the general board. But I think Amber, Keith, Chuck, myself, and Susan were present at the last selection meeting, and I think that we have a pretty good idea of a recommendation we'd like to make to the board, but we understand that we need to get that information together and get it out in a timely fashion for all the members of the board to consider. Shelly was not available at the last meeting, and because some of the information we have is confidential, we wanted to share it in person. So this is just the first time that Shelly's receiving this information. So our next meeting for the selection committee is next Wednesday. I do believe at that point, I think that that'll give Shelly time to get caught up, and I think at that point, the selection committee can get together and take an attempt to begin crafting a recommendation to the board and get that out to the board and hopefully get that ready for consideration at the September meeting.
If I can rephrase your question, though, because I think what you're trying to ask is, of the 39 counties, how many counties have a different model? Is that where you're going?
I'm just looking for that chart, not
Right.
all the broader, richer, but I would just like
Right.
to see that chart.
Well,
Right. So-
I can
and-
say that 5 counties have the approach where the health officer and the administrator are in one position, and that position is filled by a physician, but they are now the smaller health districts, and the trend is to go away from that model rather than toward it. That's what I do
That's
know.
partly,
Right,
but
so-
I'm looking for a chart, really.
Right,
Just-
and I'm trying to remember, because we asked this question actually at the very, very beginning, because in some of your really, really small counties, they're not health districts, they're health departments under the Board of Commissioners. And it's in the larger counties that they've gone to separate health districts. And so it's really, of those counties, which ones have the separated out. And I thought we put that together when we originally asked this question. So I think we need to look back through.
And I appreciate there's a richness of the conversation, that's not what but it would be helpful in
Yep.
advance of actually the meeting to see, and my question is, you can call it different things, but is it a doctor reporting to the board as first, who may or may not have an administrator working under them, or is it the administrator to the board? That's mine.
So, and I know we put some information together because it's Clark County, what do they have? Pierce County, what do they have? And I know we at least verbally had the discussion and the research was done, but I don't think it would be difficult to put it.
Well, I think we could do a simple chart
Yeah,
that
I don't
would
think
do
that
that.
would be
I think
difficult.
probably Torney knows it in his head already.
Yeah.
But I think a simple chart would, but a number of those have changed just over the last couple of years, so it would take an update from maybe what you had seen before. And you're right, Shelley, a couple of the health districts, including King County now, the administrator or director reports directly to the executive director of the county.
Yep.
The Board of Health is actually only an advisory regulatory board. They have no fiduciary responsibility. So every county is unique in a number of different ways. And so a chart would, I think, be helpful to really lay that out.
I think, Brian, what you're asking is we can do that. We just haven't prepared that, and we can get that ready for you guys. Amber?
So we definitely need to put together a packet, and we can work on what needs to go on that in that packet next week. Yes. I think for me, there's a couple different layers. There's the one, so even if another district has the health officer being kind of under an administrator and having the direction over medical communicable disease, sometimes the policy, health policy. You can really shape, though, the job descriptions of those two individuals. Even if counties, if I understand this correctly, and Keith, you can correct me if I'm wrong, but even if you have the different model than what we've currently had, you can shape those job descriptions in the way that you think is best fit for this particular area. So you may give more, in some counties, the health officer actually is in charge of several divisions, or, they are more active in terms of the state legislation and policy and health policy statewide, and working with the other health officers in that capacity to advocate for whether it's funding or education or whatever it is at the state. So you can also shape the job descriptions. We don't have to I would guess that even if they have a certain model, every job description is different too, based on the needs of that health district or county health department. So I think that the decision tree will be for this group, do we want to go to the different model? And then how would we divide up the responsibilities between those two individuals, because we'd have to write a job description that would work for us here if the board decided to go to a different model. And then I just wanted to comment too that we should probably, as we're developing the white paper or the packet for the next board meeting, I think it would be valuable for us to check in with staff too at this point, because we really haven't involved staff because we've been doing our own board due diligence and doing our own research. But I think it would be valuable to get some feedback about changing the model, with staff as well. So.
And to that point, the reason that the selection committee did so many interviews is that none of the job descriptions for the counties are the same. Each county has tailored that to the needs of their county. So even if they have a model where they have an administrator and a health officer, sometimes they have both of them reporting to the board, sometimes they have one under the other. But even within those counties that have similar models, the job descriptions are different. So the research that the committee has done has been to really find out all the different reasons why and what they do, and so that we can develop what works for us.
Bob.
Yeah, Keith, I'm curious, how different, if you look at what existed prior to Dr. McCullough, how different do you find the sort of the conceptual structure than what existed previously? And again, and I ask this from the standpoint of, obviously, historically, I think the health officer has always been the secretary to the board. And I think, as you're suggesting now, the model is moving more towards the administrator being that. I know that, for example, was what I saw in Clark County.
Right.
So with some of the conversations you've had, how different is what you're proposing, albeit with the exception of who would report to the board, than what existed prior, i.e., what's that structural difference between the health officer and the administrator with respect to management and things of that sort?
Well, I think one of the key issues is what Shelly brought up, is that even though there may be a structure that's a little bit different in one county, the personalities of those individuals have a huge impact on how they actually carry out their roles. So, for instance, a Dr. Chen in Tacoma Pierce is so different than any other health officer administrator. He is extremely unique. He is a political advocate for public health on so many different levels, local, state, national. There is no one else like him in the state. And when you talk to him for an hour and a half or 2 hours like we did, you hear a lot about that. And he's just unique because of who he is and how he got into the position. When we then talk with Dr. Wiseman, who is the Secretary of Health at the state, the most important thing for him is that Spokane is a very vital part of the public health system in the state, and we need to have a voice at the state level. And you can understand why he would say that from his position, because he's trying to manage across the whole state and to have issues which apply, across a much larger region than just Spokane or just Seattle or just Tacoma. And so I think you're absolutely right. It is difficult to say there's one model that's appropriate for any particular situation. It has to do with personalities as well as finding the right roles, as Amber has said, for our particular district. But I like Dr. Weissman's comment about the fact that we really need to have a voice, not just locally, but at the state. And we should be thinking about that when we think about the roles of our leadership here in Spokane. And I think that's Amber's point as well, at some level.
The thing that interests me in changing our structure is that it would free up the health officer to be able to be more of that, if we wanted to shape the job description this way, to be more of the public health advocate. And you know, one thing the board has continuously said is we would like that health officer to be engaged in the community with our partners, you know, our Providence and Deaconess and at the state level with the other health officers across the state. And so when you're also wearing the hat as administrator, you know, and Torney has been doing a lot of that work too. So again, how you create the job descriptions is really in our purview. But I liked the idea of the health officer being freed up to do some more of that work and really hone in on those what the health officer's background and specialty is probably in, which is doing the medical and you know, advising the public on those issues, as well as working on policy and connecting statewide on issues. So if we wanted to shape the job description that way, it would free up that health officer to do that rather than having that administrator hat on as well. So that was just an interesting way of looking at it.
Keith, did you?
Just one last comment from my perspective. I think for any of you who look at the materials that we'll be handing out later, you should really look at Ms. Hayes' comments about her relationship with the health officer and how it is an ongoing sort of transition to a relationship that works best for their particular health district. So they are, she and the health officer are constantly working on their relationship to see what works best, who can represent them the best at the local, state, or in the medical arena. And I think that's a key too, is to recognize it's not just, we're just not going to plug and play. This will be an opportunity for those relationships to develop over time with our support and oversight. But I don't think we can predict from day one that it's going to look a certain way and always be that way. And I would hope we as a board would have that flexibility in our oversight to allow those individuals to work on their leadership roles in a way that benefits our region the best. So I'll leave it with that. Thanks, Kevin.
Thank you, Keith. So our next steps are to prepare a white paper for the distribution to the general board as to what our recommendations would be going forward, not only to the structure of the position, but start not only the structure, but also get some ideas on what we would be looking at for a job description for these positions, things like that, and get that out for general dissemination so we can begin consideration if we want to for any recommendations that we might make. So just wanted to let the board know that we are making progress on that. It's been an interesting process for folks to become educated in not only the way we do things here, but the way other districts do their work in the state. And I do want to thank Keith and Chuck Hafner for their diligence in tracking down all these various individuals and listening to their stories, et cetera, et cetera. So with that, I'll close the Health Officer Selection Committee update and move on to some other updates for other Board of Health committees. Do we have an update from Education and Communication at this time? Thank you. For policy, Amber, I think we have a meeting coming out.
Yes, as you see on the front of your agenda, the next policy committee meeting is September 8th at 11. So we're going to, if you remember, our first item was to bring forward the suggested path for the school districts to participate in our youth survey. And so we're going to follow up then with the rest of the other policy discussion topics and hopefully bring back to you in September, at the September meeting, a couple other topics we hope that the board will consider. And I just wanted to make a brief comment that there was a great article in the Spokesman in the last week, if this is an opportune time. Just wanted to congratulate, I don't know if Lindy is here. Oh, there she is. Lindia was interviewed as part of the Sean Vestal article on Priority Spokane's work to address student and family homelessness. And so I thought that was a really good piece, and talked about how the health district was really playing a strong role as part of Priority Spokane in addressing homelessness and identifying kind of this whole other piece of homelessness that isn't necessarily coming out of the other studies and counts that are done in the community, really looking at the families that are couch surfing and doubling up and how that's impacting students and their ability to learn in the classroom. And so it's exciting because we've raised some money to hire some, I don't know what we came up with the final term. I'm calling them still community health workers. But anyway, the exciting thing is because of the report, because of the health district's contributions and all the other organizations that are part of Priority Spokane, like Spokane County and the City of Spokane and others, we've been able to raise money to hire 2 community health workers to be placed in 2 schools that applied for a pilot project to work with families that are homeless right there at the school. So we're excited to get that kicked off this fall. 2 schools up in Deer Park, and then Logan Elementary in the Spokane public school system. So anyway, congratulations, Lindia, for your work.
Thank you.
Thank you. Any questions for Amber? Last is budget and finance, and that's Keith. Do you want to save your comments for the action items? We do have some action items coming up regarding budgeting, so we'll get Keith and the budget and finance at that point. So that takes care of the chair report. Move on to the health officer report, and that would be Torney.
Yes, and Anna Halloran will give some EPI update first, and then I'll follow her.
Anna?
Good afternoon, everyone. We've had a really busy summer in communicable disease epidemiology. I'll be talking about 4 topics: pertussis, rabies, Zika, and West Nile virus. On the topic of pertussis, we have investigated 58 cases, pertussis whooping cough, 58 cases so far this year, which is only slightly higher than last year, which was also a very busy year for us. There have been 26 cases since the beginning of June, so we've had a quite busy summer. Cases have largely been in children, mostly unimmunized. There seem to be a significant number of cases in individuals from our Eastern European population locally. And many of these cases have no known connection to each other, so they're just kind of little isolated clusters across the city and county. And we've had this year at least 3 infants who've been hospitalized, unfortunately. All of them have recovered, but it's never good to see that. On the topic of rabies, it's also been quite busy for CD-EPI and environmental public health. 3 rabid bats have been identified, 1 with only animal exposure and 2 with human exposures, and one of those exposures happened up in Stevens County. We've issued 2 press releases related to bat contacts, and that has increased attention from the public as well as the media. And we've been very busy fielding calls and testing requests. EPH has shipped 36 bats to date, which is above normal, and I believe Ray will be touching on that a little bit more. And certainly beyond that, CD-EPI and EPH have been fielding many other bat calls related to bats that have not been available or testable. With Zika, recently within the last month, the CDC has discovered local transmission occurring in South Florida. That's the first time that local transmission has been occurring in the continental United States. We're at about 33 cases now. It's still being investigated, but it's believed that active transmission is isolated to one neighborhood that's north of downtown called Wynwood. And as a result of that, the CDC has issued travel warnings for that particular neighborhood. So it's advised that women who want to become pregnant or who are pregnant avoid travel to that area if it's non-essential. And outside of the continental United States, cases are still soaring in Puerto Rico, where they've just recently declared a public health emergency. Washington Department of Health has expanded testing criteria to include travel to Miami, and the state's currently at 26 cases total, all of which have been travel acquired. And call volume this summer has been light related to Zika, but may pick up with what's happening in Florida. And finally, related to West Nile, just this week, Benton County released a statement that there have been the first human cases confirmed in the state. They've had 2 individuals test positive for West Nile, and unfortunately, one of those individuals passed away. The state issued a press release related to that and included information that we've had one bird in Spokane that's tested positive recently for West Nile virus. We've had no human cases, but we're staying alert related to case detection, and I believe Ray will possibly touch on that as well. Are there any questions that I may answer?
I wanted to thank Anna. I was one of those providers who called up about a most interesting bat contact. So it was very interesting, and I think it made her day. And whether the individual actually went to the ED for vaccination has yet to be determined, but I don't think. Bottom line is the police caught the bat. Patient called 911 for a bat in the house. The police came, they caught the bat. This was out of Spokane County. They caught the bat in a paper bag using one of those stop signs to move the bat into the paper bag, and then took the bat in the vehicle out to the country and released the bat. So it made Anna's day.
You don't hear about that very often.
Anyway, it was kind of unique, and as I said, I think the contact was minimal, if anything, maybe more so for the police officer who was handling the bat in the paper bag. Don't know if you had any follow-up with that.
I did. Whitman County followed up with the police department, and at the very least was going to ask them not to do that again. I don't know what the outcome was.
Yeah.
But that was very unusual.
Yeah. And then the second thing, and I have a question for you. If I had one of my colleagues the other day thought that he had seen somebody who met the criteria for West Nile virus, but the individual refused to be evaluated and or blood work for it. In that kind of situation, I mean, is there any recourse? Not really.
No.
Yeah.
I hope they got better.
Yeah, they were in the emergency room, so. So thank you.
Any other questions for Anna? Thank you.
Thank you.
Well, good afternoon. Thank you. I have about 4 different things to share with you. The first, we will be talking about in an executive session, but just to give you a heads up that we have begun union negotiations with WSNA and very shortly begin with PTE. So we will be talking to you about guidance during an executive session. Secondly, we have worked our way through our budget process using our logical decisions for Windows software. And when we have our next Budget and Finance Committee on the 31st, we'll share with them the rankings and all of the criteria that go into our prioritizing programs and how we expend our general fund dollars at that time. But that process is well underway, and so we're looking at the prioritization where we will spend our general fund dollars. The third item is that there has been concern by staff of a few incidents that have occurred primarily in the front lobby area, and there was a desire for us to look at having a security guard who was available in the first floor, and we have moved forward to do that, and we'll start on September 1. They will be unarmed, but they will be uniformed and help expedite people who don't need to be loitering. They will help with the smoking that goes on around the building to direct them to the appropriate smoking area that is away from the sidewalks where people tend to smoke.
Will this be a full-time position, or?
It will be contracted, and so we will have them here from 7:30 until 5 days a week. Okay. So it'll be one individual.
I was going to say, the other option you could look at is looking at, the county is right there, and we have contracted security guards that if you didn't need them full-time.
Yes, I think the challenge is that when incidences have occurred, nothing has been overly serious. We did have one fight between two individuals that was a physical issue that occurred. Beyond that, it's much more nuisance related, but we can't pinpoint an hour or two. It's kind of sporadic from the time that we start dosing until after a syringe exchange is done in the afternoon. So that will begin on the 1st of September. And it appears that I pulled up raised by mistake here. And as soon as I can find out. Do you see the one that says it's mine? Don't believe it is that. That will work. At the executive committee of the board last week, I was asked to identify a few of the places where Spokane Regional Health District has been noticed outside of just Spokane. What other things we're working on? And one of those that I will cover, Amber, thank you so much, is the work that you identified. Prior to that, I wanted to talk about Invest Health, which is a process that is going on right now to impact housing homelessness issues, and it engages SNAP, Catholic Charities, the Spokane Housing Authority, City of Spokane, and Providence. That grant was actually written by Lindia and Rowena Panetta, understanding that these are issues that impact the health outcomes of our population. So it's a $60,000 grant. We were one of 50 cities that was selected. There were roughly 180 different teams that applied for this. So a great accomplishment, and though it is not being administered by public health, Rowena and Lindia are part of an ad hoc committee working with that team. And so that is one of the things that has been identified. Mariah McKay, who works in our Healthy Communities program, actually wrote this particular article in the Inlander looking about the affordable housing bubble and the challenges we face here in Spokane. So another place where you'll see the engagement of the health department in working on something that is far broader than just what we do directly seen as public health in historical terms. A few of you were able to attend the Public Health 3.0 presentation. We were very fortunate to have the Acting Assistant Secretary of Health from the Department of Health and Human Services, Dr. Karen DeSalvo here, along with Rear Admiral Dr. Patrick O'Carroll. And it was a process looking at where are those health jurisdictions across our nation that are leading the way in where Health and Human Services believes public health should be going. And on the screen you can see those locations, the 5 cities that they chose to visit. And so we felt very honored that we were identified as being one of those cities setting a trend for what public health should be doing in the country. There will be a national rollout of this information October 18th in Washington, D.C., where Dr. DeSalvo will be talking about what they have learned from these 5 cities. Their visits weren't to come and tell us about things. They were really to come to these cities to understand how is public health working and most effective. So we feel very honored that they recognized that Spokane was one of those communities. As identified in the work that is ongoing, this is the work that came out of Priority Spokane, the recognition by Robert Wood Johnson Foundation of a Culture of Health Prize winner. Spokane was identified in 2014 along with the others that you can see on the left-hand side of the page. The 2 smaller lists at the top were the 2013 and then the 2015 winners of that prize. You'll recognize if you look at the map of the U.S., there's not many far west. Once again, we are very honored to be recognized by the Robert Wood Johnson Foundation for the work that is going on. And this, as Amber alluded to earlier, is many organizations within the community. And I think one of the commonalities that you will see from the things I'm identifying here is that it's not just ourselves saying public health is doing this. It's us working with our community to improve the health conditions for people who live here. So this is on Robert Wood Johnson's page, identifying the focus on education to improve health, which came out of that first round of the culture of health, which has now evolved into looking at the homeless issue. FAB, the Public Health Accreditation Board, as most of you know, we are an accredited agency. We are one of the first 11 that were accredited in 2013. If you take a look, this is now what has followed our leadership. These departments are now also accredited. There are more than 100 more attempting right now in the queue with FAB to do this work. I wanted to acknowledge that each of these is interviewed by peers who come to a particular site and do that work. Dr. Lutz has been an individual from our agency who has represented us as a team lead in various site visits around the country as well. The 1-2-3 Care Kit is something that has come out of the nurses' development in community and family services, looking at trauma-sensitive care for caregivers of young children. This has now been requested nationally. Many states are writing to us to get copies of this. It is on our website. It has also made its way as far as Australia. So a piece that I think we can be very proud of the work that the nurses have put together to help demonstrate how to be attentive to trauma care issues. Right now, public health across the nation is working on a way to define what are called the foundational public health services. This is to identify those services that should exist in every community. And those are the ones that are identified inside the red box. You'll notice that the graph, like the various columns that have communicable disease, chronic disease, environmental public health, and so on, are split by that red line. Those portions that are below the red line are those components that we believe should exist for everybody who is served by public health in the nation. And it's challenging when you look at an agency like ours or our neighbor, Lincoln County, who has a health department with 5 people. And how do they do that? And it has gotten us into talking about shared services or regionalization. But this work, which is really being led by 5 states, Washington is seen as the premier state leading this effort. Barry Kling from Chelan Douglas has been very active in this. Last year, Commissioner Milkey co-chaired the policy portion of this work, which followed a technical work group and helped evolve this further. Oregon has taken this model, and actually their legislature has now mandated that this will be done in Oregon. And I'm not sure to what degree they're funding that yet, but it is a piece that they are looking at. Within our state, there are efforts to have this model talked about and researched for consideration by our legislature to say what should exist everywhere to serve the people of the state and who should fund that. Public health's position has been that everything inside the red box should be funded at a state level, with the additional important services, those sections above the red box, to be funded locally as needed. As an example, we don't do much with shellfish on this side of the state, but it clearly is important on the west side. Finally, I wanted to acknowledge work done. The National Academy for Public Health has different leadership segments. We have one here that is the Ebola Leadership Academy for Public Health, and that is because Sacred Heart has been identified as a key hospital if there are cases of Ebola that exist here. And so we have several individuals engaged in that from public health, from Providence, from our emergency preparedness, and Dr. Joel has been and continues to be one of those individuals who's engaged with that. Finally, wanted to identify that Kim Papich has submitted a abstract in June of this year on health communications, marketing, and media, and she was selected as one of the outstanding submittals and will present at the CDC's 11th Annual National Conference on Health Communications, Marketing, and Media on the 23rd to 25th of this month. So she will be back doing that. The other thing that I wanted to acknowledge where we have had involvement on a national scale, again, Dr. Lutz has been engaged on a couple of different occasions with the National Association of Local Boards of Health. And I have just termed out from 6 years serving on our National Association for County and City Health Officials. The person who is replacing me is Andre Fresco, who is the administrator in Yakima. And Yakima, for those of you who don't know, is the oldest established health district in the state, in the nation. So, which all began because of issues of contamination that Mayor Freeman might be working with nitrates. So, those are the updates I wanted to share. I'd be happy to answer any questions if you have them.
Any questions for Tony on this fantastic information dump? Keith?
Maybe not a question, but where does this information lie so that the public recognizes all the work of the district? Is it somewhere in the public venue?
Not to my knowledge, not consolidated in this fashion. We certainly could put the information on our website. Probably most of the recognition occurs when those activities are being carried out.
Right.
And then,
right. I just, I don't know how you do that, but I just think our community sometimes undervalues what has gone on here, and we hear about it, but the community in general sometimes, I think, doesn't hear these kinds of remarks, and they're certainly outstanding for sure.
Thank you, and frankly, all the credit goes to the tremendous number of staff that we have here who do this work day in and day out. We are very fortunate. So, thank you.
Thank you, Tony. So next item on the agenda is our Comptroller report. Mike?
Everyone hear me? All right, thank you. As you can see by the agenda, I'm coming up pretty quickly here on action items as well, with both a fee schedule and a budget amendment for this year. So I thought I'd take this opportunity to sort of update everyone of where we're at in the 2017 budget. I know Tony mentioned a little bit about that, but all the program managers have now submitted their budgets for 2017. I am working currently with all the division directors on getting the divisions rolled up and then an agency roll up. So then I can bring those numbers to the exec team on Tuesday, and then based upon any decisions or recommendations from there, that's what I'll be presenting to the Budget and Finance Committee on August 31st when we meet with them. And then the other part that becomes a big important part is Tony actually sits down with each division and goes over every program's line item by line item backup sheets, and so we go through there and see what's in those submitted budgets. And as we move forward from there, we're hoping to get down to our meeting with the Budget Finance Committee at the end of September with a strong recommendation to move forward on getting the budget out to the board in October, and then getting it passed at the October board meeting is our main goal. And so the other part I'll be working on this before the August 31st meeting is we've got the measures put in for LDW. I just don't have the cost factors in there yet till I get all the costs from the division. So I'll be putting those cost dollars in there, which will be part of the LDW report as well. So that's in sort of an update on 17.
Questions for Mike on 2017 budgeting? Thank you.
Thank you.
Next, moving on to the consent agenda, consisting of the meeting minutes from the June 30th meeting and approval of the vouchers from June and July. Do I have a motion on the consent agenda for today?
Second.
Moved and seconded. Discussion? Do we have any discussion on any of the items? Seeing none, all in favor? Aye. Thank you. Next are our action items consisting of two financial resolutions, 1603 and 1604. We'll start with Keith and then move to Mike if Keith has any comments as the budget and finance on these resolutions.
Yeah, just a general comment from the Budget and the Finance Committee. We've reviewed both of these resolutions in detail, and the committee is in favor of these two action items. Just so you know, 3 or 4 of us have reviewed it already and have had discussion about it, so are comfortable with these action items so that Mike can explain them in more detail.
Thank you. Any questions for Keith before we move on to Mike? None? Mike? Thank you.
One thing I want to remind the board is what we do is whenever we come with a budget amendment, it's usually for one of two reasons. There's either new funding that we get that we want to be telling the board about and all excited about, or if we need more expenditure authority, either as an agency or as divisionals. Although this isn't new funding coming in, there was some additional funding that came on that's really the main cause of this budget amendment. Both the treatment services and the community family services division had some increased funding coming in. Treatment services, the Board of County Commissioners raised the amount of clients that they were having in treatment services up to the 1,000, from 750 up to 1,000. So of course that brought in more revenue, which then of course caused more expenses of having to pick up more counselors, more nursing, more dispensary staff, and so they need to get their budget authority up a little higher. CFS we have the Office of the Superintendent of Public Instruction gives money out to the school districts for children with special health care needs in their district. And so both the per rate has went up and the number of children in each area has went up. That increased the amount that the school districts are now giving to us, and then the amount that we're passing through to providers to provide the service. So in both those cases, we needed to get a more expenditure authority in those divisions for this year.
Questions for Mike?
Well, and I think, too, we were just going to have both of these resolutions run as a package because they're really part of the same thing. Is that correct, Mike?
I don't mind them separated. It's up to you.
So any questions about the fee schedule or the change in the budget would be appropriate for Mike.
I just had a quick question about the fee schedule.
Yes.
Standard hourly rate is referenced several times throughout. What is that rate, and has that rate changed?
It did not. Right? I don't know if you know. I think the rate stayed the same, and it is listed there.
I was looking through. I
somewhere.
couldn't figure out where, and maybe it's in here somewhere. But I kept seeing standard hourly rate, standard hourly rate.
Oh, it's on page 3. Page 3, the very first thing under environmental public health.
103.
Under general fees is their standard hourly
Great,
rate.
thank you.
You're welcome.
Any other questions? So we'll take these individually. Do I have a motion on Resolution 1603 as presented? So moved. Moved and seconded. Any discussion? Seeing none, all in favor? Aye. And that is unanimous. Let's move to Resolution 1604. Do I have a motion on 1604? So moved. Second. Moved and seconded. Any discussion on 1604? All in favor? Aye. That is unanimous. Thank you very much, Ray. Thank you. Mike. Next up is Ray. Next up is Ray with the report on Environmental Public Health Division. Thank you. Getting ahead of myself.
We're excited to see this report. You better be. Been up there a couple times. Yeah. Well, I thought Torny was going to take my spot here, so. All right, afternoon. Welcome to our new member. I'm Ray Byrne, Director for Environmental Public Health, and I was asked to do a brief overview of what we do and address some of the challenges that we may be facing and going ahead, and then what are some of the opportunities that we have. So, So to start with, what we're focusing on again is the core functions of public health. Environmental public health, our main role is in the insurance side. We do assessment within our programs, and then we also look at policy development, but the policy development is more at the state level than what we are. So we certainly participate in that, but it's our piece is more on the insurance side. So probably the best known program that we have, obviously, is our food program. The food program, currently we inspect all retail food establishments within the county. That would be your restaurants, grocery stores, temporary food events. We also do food safety education through our food and beverage permit and activities like that. Right now we currently have 9 food inspectors as well as 3 other support staff in that program. Our living environment, that includes water recreation. We inspect and do reviews on all pools, spas, and as well as participate in countywide drowning prevention activities. We have school health and safety, and this is a complete overview of our schools from the built, making sure that they comply with all regulations, safety from playground to labs, environment within the school, and then also the food side of that, which is covered by the food safety program. Zoonotic disease, which Anna was mentioning earlier, would cover rabies, Zika, West Nile virus. In that we ship any animals or bats or anything like that to the state for testing for rabies. We do monitoring and surveillance on the West Nile side, and then also some with rodents in that. As far as Zika goes, it's more in a supportive role. If we had cases that were reported in the county, then we would work with our EPI department to do follow-up and monitor that. Environmental resources, and this includes our liquid waste, so septic systems. Again, we work with local engineers, and this is for residents or commercial facilities. We would work with local engineers and designers to design the systems, and then with the installers to make sure that they're properly installed, and then finally look at the as-built and the final design of the system to make sure that it's been installed right. We have, this program also deals with any complaints that may be related to surface contamination or exposure to fluids or such from septic systems. Our solid waste, we currently permit all the solid waste facilities in Spokane County, and that would be related to our transfer stations, the landfills where the waste is going, waste to energy plant. And so again, we monitor and help in the design factor, monitoring how the waste is disposed of, and then follow up once the landfills have been closed. Land use, that is when plats are put forward by developers, we are involved and work with the local county as far as the development of the land. So we review all plats to make sure that potable water and septic systems or sewer are available to those lots, and to make sure they're in compliance with state and local regulations. And last, our local source control. We're working with businesses to help monitor and direct them in the proper storage and disposal of their toxic waste, to make sure that we're preventing contamination into our surface water and our aquifer. Our piece in that is the preventive side. The monitoring of the rivers and that falls under Department of Ecology. So we work hand in hand with them. And then last is our program support, and that's myself as director, as well as administrative staff and database maintenance. And then we also have Eric Meyer is our administrative technical advisor. He works closely with any of the building departments to make sure that what we're doing, if we have any regulations that would apply to the development side, we do a pre-construction to advise them of what the developers as to what necessary steps they would take to meet our code. So, what do we do? I think most of the public sees us, we're the enforcement side. We're not quite as glitzy as some of the other programs because what we're doing is we're protecting the public's health from the environmental side. So most people think of environment that we're looking at protecting the environment from the people. We're the opposite. So Department of Ecology is taking care of the people to the environment. We're looking at the aspects of what health aspects and safety measures need to be taken for the environment to protect the people. So there's some confusion there. We work hand in hand with them, but that's our side. So some of what we do, our role as enforcing the WAC state codes is both enforcement, training, and consulting. And we try and lean more on the training and consulting side, because if you can get that across, then the policies, then the enforcement is lightened. So some of the activities that we do, we work with our local pet shops and petting zoos. This is more on a consultation. We provide them with handouts, direct them as to what the requirements are under the regs, and then offer assistance if there's questions there. Food safety educational visits. As part of the food safety program, we've recently implemented more of a one-on-one educational visits up front, either new establishments or if you've got establishments that we've got enforcement activity with. So we'll go in, make announced visits on those, try and tailor the training specific to the items of concern versus going in, doing an inspection, discovering it at that point, and then being forced to take enforcement action. And we've seen a lot of positive movement in that side. Food worker training, there's a statewide WAC that requires that any food workers that are handling and working in food establishments do have to hold a food worker permit. And this is mandated by the state. So we currently offer that training here. It's computerized in conjunction with Tacoma Pierce. So we issue about 22 to 23,000 permits per year. We work closely with our school programs. We do an annual educational training and workshop with them, and that's in collaboration with them. They help to put that on and assist with that. Our local source control, again, those are voluntary visits. So we would contact the businesses of concern, set up an appointment, go out, review their policies, what chemicals they're using and how they're storing them, and then design a program that would help them to better mitigate their toxic chemicals. And as you can see here, this was a before our visit, what we found when we got there, and then the picture on the right there is the consequences of our visit, and that's the chemicals were removed, properly stored, or disposed of properly. As far as training in that, Spokane, as Torney was mentioning before, we're seen kind of as leaders in the state. One, certainly on the east side, but also, the general public comes to us for a lot of questions, whether it's healthy homes and they're asking mold questions or air quality, or we've got a complaint with a septic system or proper food handling, anything like that. And we'll answer those questions to the general public as well as industry. The industry strongly looks to us. our activities in helping them change their policies and procedures certainly helps the profitable end, but it also helps to make sure that they're in compliant, which helps us out on the enforcement side. Other health jurisdictions from around the state, again, you know, Spokane being the size that we are and regional, we've got most of the surrounding counties around us are looking to Spokane to provide the knowledge or the training to help their programs move forward. An example would be our school program. A lot of the jurisdictions around the state don't have school programs, but they're looking to start one, and we're providing that education and the training for that. DOH often looks at us to provide either examples of what we're seeing, weigh in to help make the decisions from their side, interpreting the code, and certainly lean on us as far as the adoption of new codes and that, new WACs. They look to us to provide guidance on that. So, and then also even at the national level, and that an example of that is recently this summer our program manager for Living Environment, Julie Aubry, and Steve Main provided or participated in the National Environmental Health Association, their annual educational conference, and did a session on some of the activities that are happening here in our schools. So kudos to them. So we've got, last year we put together some short snippets of some of the collaborations and such that we're doing throughout the communities and the different programs. Some of you may have seen this, but I think it's a good example of what we do and how we impact. So it's about 3 minutes long.
The Environmental Resources Program participates in collaborative community efforts aimed at educating the public about protecting and improving the water quality in the aquifer in the Spokane River. Program staff worked for over a year on a committee from Idaho and Washington to produce the Spokane Valley Rathdrum Prairie Aquifer Atlas 2015 edition that includes brand new pollution prevention information.
Spokane Regional Health District's Food Safety Program participates in seminars to provide general food safety education, such as permitting requirements and food safety practices. These organizations include Eastern Washington University's Fraternities and Sororities, Spokane Nonprofit Fundraising 101, and various community organizations and student groups.
The Food Safety Program coordinates with community event and farmers market organizers to educate them on application processing and safe food handling practices. This collaboration between the Food Safety Program and coordinators helps provide safe food service for a successful event.
Each year, the Water Recreation Program works with World Relief and Spokane County Marine Enforcement Unit. We provide water safety education to our community's refugees and their families.
For the past few summers, the Zoonotic Disease Program has partnered with all local veterinarians to collect and submit ticks to the Washington State Department of Health. This is part of the state's tick surveillance efforts.
The Food Safety Program works with organizations such as Feed Spokane, a food rescue organization, and other food banks to promote donation and salvage of safe food. This helps to provide safe food to the needy and reduce food waste at our solid waste facilities.
The Environmental Resources Program provides education and outreach specific to the Spokane River. Environmental Resources is a participant to the Spokane River Regional Toxics Task Force, working to reduce PCBs in the Spokane River and the river's fish.
Our School Health and Safety Program has partnered with Spokane Public Schools to develop a series of school inspection training videos. The videos will be used to train our school partners to conduct self-inspections, as well as by other local health jurisdictions that are starting their own school inspection programs.
Our division has partnered with several building departments to enhance the commercial review process. We've implemented periodic interagency staff meetings and collaborated to develop staff reference tools. We've also created customer-friendly information and submittal forms. The result has been a streamlined process, improved agency coordination, and much better customer service.
The Local Source Control Program partners with the Spokane River Forum on EnviroStars. The mission of EnviroStars is to provide assistance and incentives for small businesses to reduce hazardous materials and waste to protect public health and the environment.
So that's just a sampling, as you can see, of some of the collaboration that we do. And again, our focus really is to try and work with them up front so that when we do go out and do the inspections, the impact is lessened. So next, as far as inspections, this is the enforcement side. So last year in 2015, we did approximately 4,118 routine inspections. As you can see, the majority of our inspections fall within that food program. And these are just the routine inspections in which we would go out and look for compliance with the code. This doesn't include our educational visits, our general consultations, plan review, or anything else. So when you look at that, you're probably doubling that number when you're incorporating all those in. So as far as the enforcement side, again, our overall goal is to protect the population from anything from the environment that may harm them. Our main objection, again, is education. What we found is that by working with them one-on-one, going in, you can change their policies, you can change their practices, and you can give them the theory as to why are we doing this and what are the side effects and the health impacts if you don't comply. So that's our main role on that. Unfortunately, in some situations, we have no recourse but to take the enforcement, and that's once we've tried the education, we've tried working with them to change their policies. If we don't get them to move in that direction, we have no recourse but to take enforcement. A lot of times you hear from the food industry specifically is that we're very heavy-handed. And I think if you look at the statistics on what we're doing here, our enforcement and our re-inspections is quite minimal. Here you see in the water recreation program, we did 524 inspections, of which 49 of them resulted in a re-inspection in which we would see the enforcement side. Of those, none of those resulted in permit suspensions. Again, that's the efforts of the program to work with those facilities to correct the problems versus coming in on the heavy hand side. The next side on the right hand side, that's the food program. We conducted over 3,000 routine inspections, and of those, 383 of those resulted in a re-inspection. And 5 of those went to a permit suspension. And again, some of the efforts that we have taken to try and prevent and reduce those suspensions, we've seen significant impacts, is that between a first re-inspection and a second, we now require them to set up an educational visit in which we go in and we specifically target the problems that they're having to try and impact and change those policies. And it's been very effective. Another side of what we do is dealing with complaints. This graph just shows on the left-hand side there, you can see that the majority of our complaints are initiated through the food program. Second would be the solid waste. We do follow up on those and then try and bring those to resolution. Some of the solid waste complaints end up getting forwarded on to either the county code enforcement or city code enforcements for them to resolve that, but we would do the initial investigation on that. So some of the challenges that we're facing. Right now, as normal, summer brings on is definitely our heaviest time. We've got a lot of construction between schools and general resident construction. We're seeing a lot more reviews across the board in all of our programs. Temporary food events, again, between June and end of September, we've got staff out working almost every single weekend covering temporary food events. And then, as Anna mentioned, we've had more bat exposures and shipments of bats to the state for testing and rabies. Our numbers in 2015 were about double what they were in 2013, and we are already ahead of the pace. We are already ahead of our numbers in 2016 than we were in 2015. So if it continues on this, it's a significant difference. Probably one of the biggest challenges that we've had is that Environmental Public Health took on a new software this year to try and consolidate and match up all of our databases within the division so that we can cross-reference what's going on in one program to another. And so we've had some major challenges with that software company in trying to get set up. And we've been on it for about 8 months now, and we're still trying to work through those solutions. And then last is staff. We've had, through retirements and promotions, we've had significant staff changes. And so we're trying to get staff up to speed, as well as you can see here, this is what our division looks like right now. As you probably noticed if you came through the front doors, the elevators are under construction. So in order to get to the VA on the 4th floor, they now have to route through our division. So this is what it currently looks like. This is our best attempt at getting them through. And then now we thought about that, but the maintenance was hesitant about that because they can't get them up off the floor. So this is just an example of some of the staff changes that we had. So this is what our division looked like at the end of 2015. So as we went into 2016, what you see there in red, these were all retirements. We had one staff member that left to take another position, and we had one staff member that has moved to our epidemiology department. But all the rest of those are retirements. But the impacts that has is that because 3 of those positions were upper level positions and promotions, it starts having a pretty big impact. So these are positions that now have been affected through promotions or laterals. And this is an example of where we are now through filling new staff positions. So as you can see, we're about 60% of our staff are either in new positions or brand new to the division. So some of the challenges, this is probably going to be our biggest challenge going forward. We lost a lot of knowledge, but at the same time, we have people that have moved, taken lateral positions or through promotions. They're still with us, they're just not in the same capacity. So we've still got that knowledge there and the guidance, but that's the challenge, is to try and get that new staff trained up. So as far as going ahead, again, our focus for 2017 is getting back up to where we should be, building the capacity, getting the training that we need, and then taking a look at where we need to go. And some of that is trying to make sure that we're aligned with both national and state direction and what they're planning on doing, and working to identify gaps that we feel that we're missing. So actually, before we go there, I know Dr. Lutz had a question, as far as one of the questions was what are we looking at moving forward? As part of the visit from Dr. DeSalvo, Public Health 3.0, one of the things that's coming out both nationally and locally at the state level is dealing with healthy homes and the built environment. So I know those are discussions that are just starting, especially at the state level. There's been some committees that have been formed to decide at what level is environmental public health going to get involved in the built environment, and if so, how do we move forward with that? Currently, there are no regulations that would force developers or encourage developers to make the changes necessary for the built environment. But I think that's something that's going to be, as we move forward, it's certainly on the forefront. Questions?
Questions for Ray? Keith?
I do have maybe it's not a quick question, but it's a question. I just ran into a lease agreement for a rental, and in there was this comment about how if this building was built before 1977, we have to tell you about lead paint. And it got me thinking about all the lead in the school pipes, drinking water, all that. there's just a lot of lead stuff out there. And then, of course, all the environmental issues in Kellogg and all that, all around lead. And the reason I'm interested in it is because it affects young children, and they have no way to sort of keep themselves from being impacted. I just wondered if you had any jurisdiction over any of those kinds of issues, or is that really is that ecology, or who is it that really is dealing with all of that sort of leftover environmental issues from our past?
It's a combination. We used to operate underground with site hazard assessment, and that was ecology would identify the sites of concern. They would forward them to us. We'd do an evaluation on the site and then determine the level of contamination and then send it back to ecology, and they would come up with a plan and then follow through the cleanup. So on the big sites, that's more of an ecology issue. At the state level, the governor, and part of this has initiated through Flint, Michigan, with the drinking water. So the governor has recently issued a directive that there's 7 different items that concern lead. Some of those are water testing, both in schools and then public water systems. It's dealing with rental homes, making sure. Yes. Yeah, because after, I believe, 78 or 72, the lead was, for the most part, removed from paint. So rentals, there's 7 different areas in which he's asking for the state to give guidance on. They've formed committees throughout the state now to deal with that, and there will be a directive and recommendation going back to him for an October 1st deadline. So we don't know where we're going to fall, as far as if we have children in a home such as that has lead paint and there could be an exposure. If they do testing on that and it's a high level, it gets referred to us in our EPI department. And we would do surveillance on that. We'd go out, do a consult with them, try and see if we can identify the source that's causing the high levels.
That's all.
So,
Thank you.
yeah.
Mr. French.
So who or what is pushing the initiative to get more involved in the built environment?
Well, I think it's the general public as a whole. Again, I think at the national level and even at the state level, those discussions are just starting. I don't know whether it's going to be going forward as, okay, these are the things that we would like you to have the discussion with the developers, or if they're looking more towards these are regulations that we feel need to be put into place. I couldn't answer that. At this point, it's a discussion issue. The statewide directors, they've had 2 meetings. I would say that it's probably going to be a year or 2 before they ever come up with a policy or move in that direction. But I don't think that there's any one entity that's pushing towards that. I think it's looking at the bigger scope of things and how do you, through the built environment, how do you impact some of the outcomes in a community?
So one of the state boards I serve on is the State Building Code Council. And I would suggest to you that some of the issues that we are challenged by in terms of homes, for instance, are created by an energy code that requires a house to be airtight, that then leads to opportunities for mold and other problems. And so as you engage in this conversation, you might want to reach out to the Building Code Council, and because that's where a lot of these issues are created by an agenda to try and achieve energy at the expense of other items. So just a suggestion for you if you're really going to pursue this. Building codes are the ones that are driving builders to do what they're doing.
Yeah, and I think so, when we're talking the built environment, it's not necessarily just the housing piece, it's the whole streets and sidewalks and healthy foods and that whole piece. But the healthy homes is more looking at, what's the consequence of stuff like that. And I think sometimes when those codes are developed, those things are overlooked. And so now, once those have been in place for a while, we're starting to see some of those impacts on that. And how do we deal with that?
Other questions? Bob?
Yeah, Ray, good report. Thank you. Two questions for you. First of all, with respect to, as a board, are there policy areas, are there things which you see through environmental public health that we could be of support for you in the immediate and, more importantly, in the future? I mean, you mentioned, I'm sorry, you just alluded to the fact that many of the policies actually are generated, for example, at the state. Mm-hmm. But I'm sure that there are obviously, as they trickle down, other things that we can be proactive with to support some of the initiatives and endeavors that your program is pushing forward.
Again, I think in the built environment and healthy home side, we kind of have to wait to see what comes out from the national and the state level before we can ever delve into how we're going to deal with it here locally. Again, I have no anticipation whether it's going to be through regulation or whether it's going to be through recommendations. Right now we can make recommendations to developers to try and incorporate in sidewalks and parks and that's really where our authority stops, because there is nothing that forces them to go that direction. So I think right now it's kind of premature to do that. I would say in the near future, once we start getting into those realms, staffing is going to become an issue. Right now we are at capacity. We don't have enough staff currently to take on these realms. Even in the follow-up with lead, if we see those numbers rise significantly, it's going to impact our staff enough that we're going to have to look at additions for that. So that's going to come down to a funding request.
And then the second area is, you mentioned earlier how EPH looks at how the environment affects public health. And, this year, for example, you hear about the fires raging in Southern California. We hear about more heat extremes, more weather extremes, zoonoses, for example. And those are all examples of how the environment affects public health. And certainly there's been a push over the last decade plus of looking at sort of a new approach or a new element of environmental public health, i.e. how those environmental effects really do impact human health. I mean, do you see opportunities for the agency, for us as a board, to be sort of looking a little bit in that direction?
Yeah, I think there's always engagement from the board certainly is important. I think, when you're mentioning the fires and the impacts of the smoke and that, again, that's a whole community issue. It's trying to bring fire departments together and bring Forest Service and landowners together to start thinning projects and trying to make sure, again, it's that forward thinking. How do we do things now that will have a long impact? And some of that is the thinning and some of that. Yes, there are negative impacts to that, but there's also positives, and some of that is trying to reduce the smokes and stop the fires. Again, a lot of those conversations now it's just participation in the conversation. And certainly board engagement in that heightens that.
Other questions for Ray? Ray, thank you very much. Excellent presentation. We appreciate it. Next up on our agenda is an executive session, a discussion with legal counsel regarding agency litigation pursuant to RCW 42.31110(1)I and labor negotiation guidance pursuant to RCW 42.3144. We would ask that Michelle, Torney Smith, Sue Winters, and Mike Riley remain as part of this executive session. We're looking for Michelle, you think how many minutes? Looking for an executive session for 15 minutes, so we will reconvene at approximately, we can extend if we need, so 2:15.